So moving on to insulin. Insulin is required during fetal growth because hypoinsulinemia causes growth defects in the fetus, so it's required for glucose uptake by the placenta. Optimal growth requires insulin, and that's because insulin is your main metabolic hormone. The role is to regulate metabolism, increase protein uptake, increase glucose uptake, increase fat uptake, and these are all the building blocks you need to grow. And so without enough insulin, you get defects in your growth and a failure to thrive. But insulin is also known to stimulate osteoblasts, to promote bone formation, and so it's required then for your skeletal development. Moving on then to glucocorticoids. These are released from the adrenal gland, and normal growth requires normal levels of cortisol. However, too much and it inhibits DNA synthesis and inhibits growth hormone release, and thus can inhibit normal growth. So you need a certain amount of cortisol to maintain normal growth, but beyond that it can start to inhibit it through its effects on DNA synthesis and on the release of growth hormone. Another thing that it does is that it's known to inhibit the effect of osteoblasts. Remember, osteoblasts create bone, osteoclasts degrade bone, and so by inhibiting the actions of osteoblasts, it can cause degradation of bone and osteoporosis as a result. And exogenous administration of corticoids has a potential side effect of bone demineralization. So someone who's on a course of corticosteroids might actually suffer from brittle bones. But one thing we need to point out here, because cortisol is a very important hormone that has effects all over the body, and just for your own learning, it's important to point out some of these effects. That's shown on the next slide. And so some of the things that cortisol does is that it decreases connective tissue. We talked about in the food to fuel block, it inhibits inflammatory responses. It's very important to stop wayward immune responses in times of stress. It also maintains blood pressure by stimulating the hormone, the enzyme required for producing epinephrine, phenylethylamine transferase. It's important in the maturation of the fetus. It has mineralocorticoid activity. It modulates emotional tone, maintains muscle, and decreases bone formation and increases bone resorption. And all these things you need to know about the effects of cortisol. And in the absence of cortisol, you get, it's called adrenal insufficiency. So this might happen after someone has had a course of steroids and come off it. You have weakness, hyperpigmentation of the skin, weight loss, salt craving, syncope, and hypertension. And then people who suffer from hypercortisol secretion or Cushing syndrome, they have redistribution of body fat, moon face, and abdominal fat distribution, weight gain, fatigue and weakness, hypertension due to cortisol's effect on blood pressure, menstrual irregularity, as cortisol can influence the menstrual cycle, personality changes due to the effects of cortisol on the brain and your emotional state, muscle wasting because cortisol stimulates proteolysis, edema, again related to blood pressure, thinning of bones, glucose intolerance because it's diabetogenic, and the thinning of skin because of its effects on fibroblasts. And all these effects are summarized in the previous slide of the overall effects of glucocorticoids on the body.